Thanks so much. Let me begin by acknowledging the Gadigal people of the Eora Nation as the traditional owners of the land on which we meet, and also acknowledge, I'm not sure if Greg Hunt's still here, but obviously Catherine King, Bastion Seidel, who's done a wonderful job as college president, Vice President Edwin Cruz, the RACGB council members, CEO Zena Burgess, fellows, trainees, and conference delegates. Thanks so much for having me here, and I know I've messed you around a bit with the schedule, so thanks for accommodating me. I'm here as leader of the Australian Greens, but also as a doctor and as somebody who's brought that experience into the parliament. And people do often ask me, why did you take the huge slide from one of the most respected professions in the world to one of the least respected professions in the world? Dad asks me that all the time. I have a view of medicine that's a bit like Rudolf Virchow. He was the 19th century physician, pathologist, biologist, writer and politician. And he was convinced that social inequality was the root cause of ill health and that medicine therefore needed to be a social science. In fact, one of his most famous quotes is that medicine is a social science and politics is nothing but medicine at a larger scale. And that's my view of politics. I went from being a GP to a public health physician to a politician, and for me that was a very logical progression. The skills you learn in medicine, some of them are transferable in politics. You've got to think on your feet, you've got to be a good problem solver, understand issues in their broader context. Having a working knowledge of psychopathology and personality disorders also helps. And let me tell you, I've made a few diagnoses over the years. Let me get to the main point here, and that is that primary care is the focal point of our health system. It's doctors, GPs like you that are effectively the entry point to the health system for millions of Australians. The college is 19,000 GPs, more than 26,000 members. You're the people who provide first-line care to Australians, young and old, every single day. It's care that's not just about returning people to health, but you're also preventing illness. You're keeping people out of hospital. And we think it's a worthy investment. We think the work that you do is not just a cost and burden to the health system, it's a huge investment. And we need to start looking at primary care as the most cost-effective investment in our health system. I don't think the government sees it that way. Since they took office in 2013, happy if you want to clap that. I mean, look, since they came to power in 2013, their underlying philosophy is, how do we keep people away from general practice? How do we stop them going to their GP? Put in co-payments. Thankfully, the Senate rejected those. There's the MBS freeze, which I think tells a really clear story about how the government feels about primary care. They just don't understand the benefits of care provided by GPs and why that is so critical in having a cost-effective health system and one that looks after everybody. It seems that their priority is more about cost-cutting and cost-shifting than it is about meaningful healthcare reform. And I don't get it, I really don't get it. Supposedly the party that is the party of economic rationalists think that it makes sense to take costs off the federal bottom line, shift them onto states and actually have the health system overall costing us more. It just doesn't make sense. And I have to say I'm proud to have stood with doctors, indeed with the Labor Party, in opposition to the freeze. I have to say first introduced by Labor, but we do support the fact that the freeze is now coming off. We do think it's too slow. It needs to happen more quickly and it needs to happen in full. That doesn't mean the problem's fixed and that's all we need to do. There is, I think, a case to look at trialling new models of care. And when the notion of the patient-centred medical home model was introduced, we supported the idea. We think the trial theoretically was a good idea, but the implementation has been terrible in practice. They've adopted this sort of theoretical framework that we think has a lot of potential, better integration of care, improved management of chronic disease, but what they've emerged with is this poorly funded, poorly directed trial. It's not going to be done for long enough to be able to assess it meaningfully. And what it's actually starting to look like is an exercise in the rationing of healthcare, and we certainly don't support that. It's not easy, we know that. It's not easy, but the Greens are very much focused on primary healthcare reform that's in the interests of patients and doctors. We've got this rising chronic disease, we all know that, and it does require a different approach. One that is led by GPs, one that involves a wrapping around of the skills and care that we see in allied health professionals. We need to look at different approaches, bundling of care, but making sure that it's not rationing of care, that it's a genuine increase in funding. And it recognises that what's being provided is very complex management of patients. If we're going to do it, firstly, we need a commitment to that sort of reform. It's going to take time, it's going to require a lot of effort, it's going to require a partnership between government, the profession, and of course patients. We've got to be prepared to trial new things. We're going to make a few mistakes along the way. We have to learn from them, but we do have to show some innovation in this area. And that's why at the last election we went to the election with the $4.3 billion commitment to the strategy, to a primary care strategy, on top of the existing money that we spend in general practice. It's a plan that, again, looks at innovative models of care. It ensures that we're able to fund allied health professionals like dietitians and podiatrists and the many others who currently are excluded from our universal health system and where user pay seems to be the dominant model. And we know that as health professionals, our system works best when we're working with each other, when the system is integrated, and where we are able to provide the sort of care that patients expect from us. But we also think that a hell of a lot more needs to be done in the prevention space. We're seeing a rise of chronic disease. It's not happening by accident. You know, people didn't suddenly mutate over the last few decades and become overweight and unhealthy. It wasn't some genetic accident. It's a direct result of the society that we now live in. We've got huge calories in processed foods. People spend longer hours at work. We've got towns and cities that are planned almost exclusively around the motor car. We've got screens wherever we turn, fewer opportunities for physical activity. All of those things have combined together to mean that Australians are becoming sicker. And we talk about progress a lot. My view of progress is that one of the cornerstones of progress has to be that we hand down better living conditions to the generations that come after us. And we are at risk of being the first generation that hands down a lower life expectancy to our kids than we enjoyed. And on any measure, that is a reversal of the progress that we've made over many, many centuries. If you're a good government, you look ahead, you look at where these trends are heading, and you make interventions to turn those trends around. You recognise the importance of social and environmental factors in people's health outcomes. You don't just blame them for making poor choices. You work to fix a system, a society that is leading to people becoming sicker. I have to say, when I first took on the gig, one of the first things that I saw in the health space was the government abolish the Preventative Health Agency. And I just thought, why on earth, of all the things to cut, would you cut focus on prevention? They cut funding for what's called flexible funds, and flexible funds deliver a whole range of health promotion projects right across the country through local government, and they were making real progress. And of course, this week, the Productivity Commission, which hardly is a bastion of, far left radical ideology, it's a Productivity Commission, and they've said, you've got to make sure that you start to deal with issues like obesity and chronic illness because it impacts on productivity. Now, they look at it through the lens of productivity. It's important. We know there's a huge economic cost, but there are huge social costs associated with the rise of chronic disease. And that's why we Greens are very committed to ensuring that we have a greater investment in prevention. Policies that help to turn around the direction of health in the nation. And look, it's hard. It's hard because these are things that work beyond short-term electoral cycles. It's hard because you don't get letters from people saying, thanks so much for implementing a public health policy that prevented me from having a heart attack. The people who benefit most don't actually know they've benefited. It's difficult, and that's why politicians often respond to the here and now rather than looking ahead. But we have to look ahead if we're going to turn this thing around. And that's why the Greens have led the debate on difficult issues like the implementation of a tax on sugar-sweetened beverages. And I think it's time we started following the advice of, for example, the various colleges, the presidents of the colleges who have come together and said we need to do this, the AMA, the Obesity Policy Coalition, the Grattan Institute, all of whom have come together and said these are products that have no nutritional value, they deliver empty calories, they're making people sick, especially kids, and it's about time we did something about it. And we don't want to stop there. There's much more that needs to be done. The Greens want to see mandatory food labelling to replace the confusing and optional system that we've got at the moment. Strong restrictions on junk food advertising to kids. Funding to support communities in making sure that urban environments support physical activity. Investment in disadvantaged communities to make sure that kids are able to engage in sport and exercise and that there aren't financial barriers to that. And of course, strong measures to turn around the harms associated with alcohol. We should start by abolishing the wine equalisation tax. It was highlighted again by the Productivity Commission this week, and replace it with a volumetric tax on alcohol. I mean, at the moment, the taxation of alcohol is a dog's breakfast. It's complicated, but the bottom line is we tax wine in a way that means that you get an advantage if you produce cheap, high alcohol wine. Why on earth would we do that? We need to have reform in that space. We want to close the loophole that says you're not allowed to advertise alcohol, or you can't have alcohol ads that target kids during children's viewing times, but we'll make an exception for televised sport. If it's footy or cricket, sky's the limit. Are we expected to believe that kids don't watch televised sport on a Saturday or Sunday afternoon? We have to close that loophole. We know what's stopping it. Those huge vested interests, the alcohol industry, the broadcasters, all of whom stand to make a buck from it. We've got to stop players running around with their shirts emblazoned in 4X logos and VB logos. I thought it was really interesting when, I can't remember which cricket captain it was, one of the players had got in trouble for going out and getting involved in a fight. Was obviously on the booze all night. And there he was with his hat on, with the VB logo, hosting a press conference explaining why this was a bad thing. Well, we've got our priorities wrong if we think that promoting alcohol through sport is sensible. And I think ultimately they're actions that save money. It's money that can be invested in primary care. It's money that can be invested in ensuring that we turn around the growing epidemic of chronic disease. And let me just assure you that as a leader of the Greens, I'm absolutely committed to ensuring that we see change in all of these areas. There are a range of other things that we're trying to progress. We want to start having a different conversation around illicit drugs so that we see this as a health issue, not a law and order issue, where we have a greater investment in treatment rather than using our courts and the police to effectively prosecute what is a social issue. I want to also take the opportunity to congratulate the college for their statements on support of voluntary assisted dying. I think you've taken a really brave and important stand. It's difficult. I myself, as a GP, have wrestled with the idea. I didn't come at this decision lightly. But it is a change that's coming. It's going to have a major impact on your profession because you're the ones that care for people at the end of their lives. You're the ones who are dealing with these difficult issues every day, and I want to really congratulate you for engaging meaningfully in this debate. It's not a change that's going to be thrust on anyone, patients or doctors, but it is, I think, an option that some people will use to relieve them of suffering, and just knowing that they have that option there is of great comfort to many people. Medicinal cannabis is another issue that I know the college has been involved in. I've had very productive conversations with the college. I know there's a lot of concern around the lack of education, the lack of clarity on this. I've also heard from GPs across the country who want to engage more actively with medicinal cannabis. They're very frustrated at the layers of regulation that exist. We're doing what we can to fix it and to make sure that there are efforts directed at increasing the education and support that you receive in this important area. Again, it's another change that's inevitable. It's happening right around the world, and it's great that the college is actively engaged in it. I'll finish finally, of course, with climate change, and I heard that final question, absolutely critical. The Greens did go to the previous election with a policy to have a sustainable development unit so that we do see the health sector leading by example. With Labor, we have committed to the blueprint from the Climate Change and Health Alliance, a group of organisations who are absolutely committed to reversing this. I just can't believe that we are here after years of scientists and academics who are doing what they can to change the nature of the debate, and I've just spent the last week in estimates interrogating an 8-page policy that was cooked up in an office that is now being passed off as an energy policy. It shows you how much more work we need to do in advancing this debate, which should be a good debate. Addressing climate change is good for people's health. It means that people who are currently in coal communities are no longer exposed to particulate matter and the dangers associated with coal mining and combustion. It means that we get jobs in renewable energy, the investment that comes from that, and this should be a good news story. We should be embracing it. And as a country with abundant renewable energy resources, it is, again, so frustrating that we seem to be fighting against a government that is intent on propping up industries that belong in the last century. Let me just finish by thanking all of you for the work that you do. There are moments when I reflect on my career choices and think about the great satisfaction that you get most days when you actually turn people's lives around. When you're able to come home at night, despite the frustration, despite the red tape that you're often confronted with, despite the difficulties that you face in terms of running your practices, but the thing that you know that you do each and every day is make a real difference to the lives of people. That's a rare thing, and you should be very, very proud of all of that. Please know that in the Greens, and certainly in me, you've got an ally in the federal parliament, and we'll do everything we can to ensure that we work together to improve the health of all Australians. Thanks so much.
Thank you very much, Richard. We have time for one or two very, very short questions. Danny, if you want to start.
G'day, thanks Richard for that talk. GP in Adelaide, and I'm a counsellor for about 6 more hours. I work in a nice middle class area and people can pay $80 to see me. I can afford to see 3 to 4 patients per hour. And the college and everyone knows that time with patients equals quality. And I think all these new models of care and trials and all that are going to be great, but the reality is 90% of our income and the money we need to run our business is going to come from fee for service. So why can't we just reward the GPs who work in the outer metro areas, low socio-economic, Aboriginal health, mental health, aged care, homeless, friends of mine, they just have to bulk bill, they've got no choice. I just think it's really becoming not fair, and their altruism is not a bottomless pit. So we really need to do something. I'm going to be fine. My patients will pay $90, $100, whatever. But you know, what are we going to do for the GPs who work in those real areas of need?
Sure. I couldn't agree more. I couldn't agree more. And I think at the heart of any model has to be a recognition that we have to value the work that people are doing in those communities. And as somebody who's worked in Aboriginal health, as somebody who's worked as a drug and alcohol practitioner, you can't rely on doctors making those sorts of choices, as you say, altruism for many people has its limits. And the problem is the system at the moment doesn't reward people for making those choices. We have to do better. And that's why in those sorts of settings, we need to look at models that reward outcomes as much as throughput, because the current model just doesn't reward those things. So we're absolutely with you and are looking forward to working with the college to develop it. I'm sorry I've only got time for one more, but I have to go and find out whether some of my colleagues are now eligible to sit as MPs. The High Court's about to hand down its verdict, so...
Final question.
Yes.
Morton.
Senator, thank you. You talked a little about medicinal cannabis, and currently there is a lot of difficulty with the regulation, with different states looking at legislation and Commonwealth. How do you see the national regulatory framework for medicinal cannabis possibly working?
Well, it's not working at the moment. It's bottom line is it's not working. You've got, at the moment, the TGA who have, basically the TGA have put in place a framework that I think is making it very difficult for many doctors. And then, of course, you've got this added layer of state regulation. If I'm being frank, I think the problem is that we're trying to put a square peg into a round hole, and medicinal cannabis, we need to look at an alternative framework for how we regulate it. And in other nations, they've had an independent regulator charged with the specific responsibility of looking at medicinal cannabis. And I think that that's the direction we now need to head. We need to take it out of the hands of the TGA. We have to have a separate regulator, and then we have to have a commitment that we're going to streamline the regulation between all states. But I know it's making your life difficult. We're getting a lot of pressure from patients who are saying that at the moment they simply can't access it. And the government has, I think, created a level of expectation, and that's just not being met at the moment, and it's putting you in a very difficult position. We have to, I think, overhaul the regulatory framework we've got at the moment. Thanks so much, and good luck for the rest of the conference. Good on you.
Thank you very much, Richard.